Both Dr. Sharmila and myself, we are associated with HPV in various different ways. Dr. Sharmila sees children who are coming to her for the cancer vaccine, which I'm sure you have all heard about. And I see a lot of women with HPV associated illnesses, which we will talk about in a little while. So we felt this would be a wonderful platform actually to let you all know about this cancer vaccine and what issues this cancer causing virus is already doing to us in so many different ways. So to begin with, I'm going to ask Dr. Sharmila, what is this cancer vaccine about, Dr. Sharmila? Please enlighten us.
Yeah, thank you, Dr. Sai. Actually, cancer vaccine, even before we talk about cancer vaccine, probably our viewers, parents, women, all families need to know that cancer, very surprisingly, particularly cervical cancer and liver cancer, are two cancers that are caused by virus, but it also goes to say that since it is caused by an organism, this particular cancer, it can be prevented by a vaccine, like the other communicable diseases caused by viruses, which we prevent by vaccine, like you say measles, mumps, rubella, bacterial diseases like tuberculosis, which
All
can
the
be
childhood
prevented.
vaccines,
Yes,
yeah.
all the childhood vaccines. So, cervical cancer can be prevented by a vaccine. That is one good news, great news. And cervical cancer is caused by human papillomavirus, which is most of the time and largely, and I can even go to the extent of saying, is a majorly sexually transmitted disease, which is the one which causes the cancers. Yes, human papillomavirus has about 200 subspecies or whatever, out of which maybe up to a 20 of them are involved in various cancers and also kind of warts, genital warts. So, a cancer aimed at these viruses, these subtypes, can obviously prevent cancers like cervical cancer in women, anal, penile, oropharyngeal cancers in men, oropharyngeal cancers in women, and genital warts both in men and women. So, these are all, this is the array of disease burden that human papillomavirus causes, and very interestingly can be prevented just by taking vaccine, which is very much within reach.
Yes, I totally agree with what you're saying, Dr. Sharmila, because given so many cancers that can happen to a human person,
Yes,
there is
I
only
would want the people to know about the disease burden. What
right.
if this vaccine can prevent cancer, but is it really relevant? Are we really burdened by that kind of disease that we need to be taking a vaccine at all?
Look, absolutely yes, because if you look at the statistics of cervical cancer, cervix is the bottom end of the uterus, and in Indian population, we know that 1 in 8 women is diagnosed with a cancer of the cervix. If you think about 1 in 8, it's literally in your close family, there will be one woman with a cervical cancer, and apparently every 8 minutes a woman is dying of cervical cancer. So this is the most common cancer in women in India along with breast cancer. So this is a cancer which can happen to 1 in every 2 to 3 families, typically between the ages of 35 to 45. And this cancer, which is killing so many women, which is the commonest cancer in women in India, is actually caused not because of bad luck or ill fate or anything else, but just because this woman got infected with human papilloma virus. Dr. Sharmila has already mentioned there are more than 200 types of this virus, but about 20 of those types are dangerous. Of those 20, 2 types are the most dangerous. And we want to vaccinate all girls with this vaccine before they become women. That is a concept. So if you have a vaccine to protect you from HPV, which is human papilloma virus, and if this virus is not allowed to enter your body because you're already vaccinated, then when you're sexually active and you're likely to get this virus, you're already protected. But we are only talking about cervical cancer, which is a uterine, bottom end of the uterine cancer. But Dr. Sharmila has just mentioned that this virus can also cause cancer of the penis in men, anal cancer if anybody engages in anal sex, and oral sex is the commonest cause of mouth cancer and throat cancer. It might come as a shock to you. We always think tobacco smoking, tobacco chewing is what causes mouth and throat cancers, but 50% of mouth and throat cancers are due to oral sex. When the HPV goes into your mouth or throat, it stays there for 10-15 years and then makes you have a cancer. So this cancer vaccine is going to protect people from all these different types of cancers they can get due to HPV, and that is the extent of the disease burden, Dr. Sharmila. If you think about how many people in India get cancer of the cervix and mouth and throat cancers. Comparatively, anal and penile cancers are slightly
very
less,
uncommon.
but mouth and
Yes.
throat is rampant.
Yes. And while you're mentioning about this, I want all of them to know that immunizing the male child, which is already underway in US, UK and everywhere, here also the FOXI recommends it for boys, and Indian Academy of Pediatrics is very soon going to recommend it for boys. The reason being, like you said and is well known, it depends on the kind of contact during the sexual activity, and it need not be a complete sexual act. It can be just
Skin to skin.
touching the private parts using your fingers or mouth. Any of these things, everything of these things can transmit human papillomavirus, which is highly contagious. It is so contagious that you will not be surprised that unimmunized, almost everyone would have been exposed, infected and carried the virus at some point. So it is that very prevalent, that very common, and you do not have to get frightened at all.
Yeah, look, like Dr. Sharmila just mentioned, it doesn't need to be penetrative sexual intercourse. It
Yes.
just needs to be a skin to skin contact. And most of the teenagers these days, they experiment in some kind of being intimate with the opposite sex, be it hugging, cuddling, kissing, experimenting with each other and kissing. They might not necessarily engage in penetrative sexual intercourse, and that is why the focus is get the children to be vaccinated. Don't
Yes.
allow to become teenagers before you think about vaccinating. And this is a right opportunity for me to ask Dr. Sharmila exactly what the WHO recommendations are for the dosing and schedule. Please tell us, Dr. Sharmila.
It's very simple to remember. Anyone, when I say anyone, it's both girls and boys, over the age of 9 years are eligible to get vaccinated. And most importantly, between 9 to 15 years, it's only 2 doses. The latest recommendation is 2 doses if you're immunized before 15 years and 3 doses if it's after your 15th birthday. To remember it very simply. And the other thing is, anyone from 9 years to 45 years can take this vaccine. The best age is obviously 9 to 25 and even better 9 to 15. The reason being, between 9 to 15, the earlier the better. In fact, it's like before 12, you're reasonably sure you wouldn't have contracted the virus in any which way, both girls and boys. And boys should be immunized for their own self and also not to transmit the virus to their partners later. Girls have to be immunized for both the reasons, to protect themselves against cervical cancer and also not to transmit the virus. But majorly it is to protect oneself from cervical cancer, which is a killer. And it is not at all untrue when I say, like Dr. Sai mentioned, that there is one woman dying every 8 minutes out of this cancer, which is very much preventable.
Should anyone not receive the vaccine for their health conditions, or is there anybody who could become allergic to this vaccine?
In fact, most people can take it. I would even say that almost everyone can go and take this vaccine, except that very small subset of children or adults who are allergic to yeast, which is very, very uncommon. I haven't seen anyone getting an allergic reaction to this particular vaccine. The other question, Dr. Sai, they asked me is, can a pregnant woman take it? So, in this regard, I wouldn't advise a pregnant woman who knows already she's pregnant to take it. There is nothing like you have to do a pregnancy test if you're a woman before you take it. There is nothing like that. But if you're planning for a pregnancy and you're not sure whether you're pregnant or not, then better avoid the vaccine till you're sure you're not pregnant. In case you have taken the vaccine and you're already pregnant, you don't have to panic at all. There is nothing to say that the vaccine will harm the fetus.
So it is not a live vaccine?
It is not a live vaccine. It is not even a killed virus. It is just a virus-like particle. So what we call the VLPs.
Yes.
And that is the very reason why the side effects are almost nil. So it is just a little bit of pain at the injection site, feeling a little bit sore. And the other thing is that I would advise all the doctors who are immunizing to immunize the child or the adult in lying down position. There are a couple of people who might feel a little faint. It is not a life-threatening thing, but when you are standing or sitting and taking a vaccine, when you feel faint and fall down, it is quite a frightful thing in an outpatient thing.
Yeah, it's a fear of needle more than anything.
Fear of needle and any injection for that matter can cause kind of vasovagal reaction. So just lie down, take it, wait for 2 minutes, sit and stand. That's all. So almost it's very, very safe.
Good. That's so good to know that a vaccine which the WHO is recommending for all children has got such a good safety profile.
Yeah, I would want to know something from you as a gynae-oncologist and a gynecologist. So how relevant is this? There are so many people who come and ask me while I'm immunizing their children. All these mothers ask me, see, now that I have had my child, this child is already 10-year-old, I'm giving for a 10-year-old. So how relevant is it that I take the vaccine? So what is your take on that?
Well, Dr. Sharmila, it is true that when they did studies, almost 100% of people who are sexually active or have been sexually active are already HPV positive. So if you have engaged in physical intimacy with anybody, then you would be HPV positive. So if you're HPV positive already anyway, then it makes us think, what is the benefit of giving the vaccine to you? Well, we have 3 different vaccines. 2 of the vaccines cover you against 4 HPV types. 1 vaccine covers you against 9 HPV types. So if you're already sexually active, what if you never actually got any of these 9 types and now the vaccine will protect you? So one thing about the vaccine is it has never harmed anybody in any way.
Yes.
Other than the fact that you need to purchase it and get it done, it actually doesn't harm you and it might actually benefit you.
Yes, yes.
So we as doctors know that the vaccine might benefit and will never harm. So what's wrong in giving it? So there's absolutely nothing wrong in giving it, but we can't guarantee that it'll work.
Yeah.
I can guarantee it will work for your 10-year-old child, but I can't guarantee it will work for you. So we have certain strategies in place like a pap smear.
Yes.
We want all women to have a pap smear who are already sexually active, because we don't know if, 1, we never got the vaccine until recently, and 2, we don't know if the vaccine will work for you or not. So please do take the HPV vaccine if it is available and if it is affordable, but please do not stop having pap smears because you still need it, because we don't know if the vaccine will work or not. But what the WHO doesn't want is, WHO is always thinking about cost benefit analysis. So if all the higher strata, just because they can purchase all the vaccines and all the adults are taking it, then what about all those children who need the vaccine? So WHO wants all the children who are in whom it will work beautifully, take it first. And if there is any surplus of vaccine and if an adult wants to take it, by all means please take it. But don't think that you are now protected, still get your pap smear done. But what we also need to realize is we only have the pap smear to protect us from getting cervical cancer, because pap smear will tell us which woman is going to get cervical cancer, so I can stop that. But there is no test to prevent oropharyngeal mouth cancer or throat cancer. We know HPV virus can still cause mouth and throat cancers even if you are having pap smears on a regular basis. So I think there is a role in everybody taking HPV vaccine in case they don't already have the virus, because it can still protect them from mouth and throat cancers in case these people engage in kissing and oral sex and so on. So yes, my take is the vaccine is probably going to benefit a lot of adults who are in very stable monogamous relationships.
Yes. And I mean, here I would want to highlight one thing that you said more in detail is that, see, like you have 20 different serotypes, and this vaccine is going to protect you from 9 serotypes, out of which 2 of them are extremely dangerous and almost cause about 80% of the cervical cancer.
True.
The other 20% also is covered by this vaccine, and very importantly, those that cause genital warts, those that cause the rest of the cancers, all of them are there in this vaccine. Even if someone were to be HPV positive, even if someone to be having an abnormal pap smear, you are continuing to monitor yourself, but this particular vaccine will help you protect yourself against the other serotypes that you're not yet infected, and this is where the role is there. So you don't have to worry about it not acting or protecting you, but then like she said, WHO is always worried about the global health. So it wants to see that there is an equitable distribution for the high risk groups before everyone else gets it. So there is no harm and you don't have to worry, but the important thing is get your 9 to 12-year-olds, all of them, get them immunized. If you ask me who first, obviously the girl children and then the boy children, 9 to 12-year-olds, 9 to 15-year-olds. These are the boys and girls, the girls particularly, that I would want to see getting immunized.
Dr. Sharmila, I have a question for you. I sometimes get parents who have, say, 3 children. For them, giving 2 vaccines or say 3 per child is a burden. They would like all their to protect all their children, but they won't. They are not in a position to fully complete the vaccination schedule.
Yes.
Would you rather give, say, 3 doses to a 16-year-old or give 1 dose each to each of their child?
Oh, this is a very interesting question to ask. So what are the ages of the other children?
Say the other child is, one is 14, one is 15 and one is 16.
Yeah. See, in future, we are going to look at the vaccine being a single dose.
Anyway.
Any which ways. So there are studies underway which are just on the verge of being published. Right now, it is minimum 2 doses. So I think it's a tough call for a parent to say, I cannot immunize one child over the other. If there are girls and boys, my answer is easy. I would say go for the girls, get them immunized at least with 2 doses.
Because cervical cancer is so much more
rampant, and right now the recommendation is first to protect the girls against the cervical cancer. The oropharyngeal, anal, penile cancers in boys or men is still a minor burden when compared to the massive burden of cervical cancer. So first I would want the girl children to be immunized, and at the moment it is 2 doses at least before 15 years. So I think that scientifically, if I have to substantiate, this is the thing. But I'll tell you something interesting about cervical cancer, which they found out 10 years into immunization in certain countries. Very interestingly, this vaccine has herd immunity.
True.
So they've found out that even when vaccines were done only to the girl children, 6 years after the vaccination started, suddenly they noticed that the genital warts and other forms of male cancers associated with the vaccines, particularly the warts in male children, have gone down any which ways. The burden of cervical cancer incidence, genital warts in girl children, oropharyngeal, all these cancers, they've seen a clear-cut decline in countries where there is extensive immunization for all the girls. And yes, we will get more comforting data alongside, but this is a blessing in disguise. If you immunize all your girl children, as many girl children, you are also protecting your boys. And you are also protecting unimmunized girl children who for some reason are unable to afford or not aware, or they do not have an access. So please go ahead, immunize your own girl children as a priority, and maybe later on I would be talking more emphatically about the boys immunization too. Right now, what I want you to know is go and get your 9 to 15-year-old girl children immunized straight away, and not late to get immunized all children, adults included, 9 to 25-year-olds. This is the time to protect yourself and to protect so many people around you from cervical cancer and all the HPV cancers.
And what I would like to add as we end this session is every woman who has been sexually active, if you do not want to get cervical cancer, you don't need to get it. You can protect yourself 100% from cervical cancer, the commonest cancer in women, by undergoing a test called PAP test. A simple gynecological test which won't cost you more than 1500 rupees, which won't take more than a minute, and it's only once every 3 years.
And you also tell them it's not at all painful.
Absolutely not painful.
It is just like your routine gynae checkup. Neither taking the smear nor the examination are painful, and one pap smear, the first time you get it done, your gynecologist will let you know when next you need to or what to do if at all there is an abnormal result. It's not the end of the tunnel. In fact, it is going to alert you ahead and then protect you. Very important thing that Dr. Sai and I wanted to tell all of you is immunizing your children or immunizing yourself is the best thing, but definitely not a replacement to screen the disease, which is very, very important. This vaccine is not a replacement for your pap smear. You have to remember.
In future,
yes. Where are we heading in future? There are 2 or 3 things we are heading. The first thing is in future screening guidelines might change, but for that we have to extensively immunize before we look at it. And the other thing is we might be heading towards a single dose of the vaccine later on, not at the moment. And even more brighter thing that probably all of us should wait is there could be a vaccine to treat the cancer or the disease itself. But this is a long way to go. Before that, I wish and urge every parent out there to immunize their children against human papillomavirus.
And I urge every mother out there who loves their child, you want to be there for them, you don't want to get a cancer, then please undergo a monthly self-breast examination and a pap smear every 3 years. Thank you so much.
Thank you.